So once again, good afternoon on behalf of Patients Engage. We are an online platform operational for 5 years, focused on holistic and evidence-based management of chronic conditions. We really focus on the perspective of patients and family caregivers and believe in the value of lived experiences. We do believe that being informed and engaged with your own health and being proactive empowers you and leads to better quality of life and better health outcomes. Today, we're talking about emotional resilience for persons with chronic conditions or disabilities. And this is especially relevant in the times of the COVID-19 pandemic. Um, so as I said, we really have focused on lived experiences, and the value of lived experiences are twofold. One, they allow the person who's sharing to feel better about it, and most people have told us that. And also those who are reading about it or listening to it realize that they are not alone. And especially for chronic conditions, there's a lot that people can share from each other. We have been doing monthly webinars for more than 18 months, but in the last 5 weeks, we have increased and done a lot. I think we've done about like 18 webinars in the last 5 weeks alone. And these allow you to interact with experts, with people with lived experiences on a wide range of topics, especially in the context of the difficult times we are in. Uh, People are more anxious. People are, their care and self-care routines have been interrupted. They are feeling, on the one hand, more isolated. On the other hand, there's a loss of privacy that they're finding difficult to handle. They are worried about the consequences of extended lockdown, or, however long, the fact that we'll have to coexist with the coronavirus. But I think what we strongly believe is that if you understand what to focus on and uh, learn from experiences as well as from experts as to how to make the transition from fear to growth while learning along the way, that will really help you in these times, and that's really the key to resilience. So we have with us today Divya Parashar, who is a clinical and rehab psychologist, and she has worked a lot in the past with the spinal uh, the Spinal Injury Institute in Delhi, and so she's worked with people with chronic conditions. She's worked with people with disabilities, and we are here to talk to her about how we can all move forward given our anxieties, given our concerns with limited care options or whatever has got disrupted, right? Um, just a quick reminder, this session is getting recorded, and this advice is not medical advice. It's not specific enough. So, it does not replace a private consultation. If you are logged into Zoom, you can post your questions on the Q&A. And if you are on Facebook, you can post your comments, questions on the live feed. For those of you who are familiar with Zoom, you know that you can get privacy by renaming yourself as well. And as always, you can reach us at editor@patientsengage.com. And our website, www.patientsengage.com, our Facebook page, Twitter, Instagram, and all of these get uploaded onto our YouTube channel as well. So let me hand over to change the slides and switch to. Okay. So, and now let me start with Divya. So over to you,
So
Divya.
much,
Can you see the
Aparna,
slides?
and yeah, I can. Thank you. Oh, and I have to keep reminding you to keep switching. Thanks so
Yeah.
much, and thank you for all who've logged in. And I just will briefly, kind of in the next 10 minutes or so, talk about the concept of emotional resilience, and then of course I would really want questions to come in so that we can make it more interactive that way. Next slide, please, Parna. What I will be talking about is, of course, a little bit of context on what are the fears and anxieties of people with chronic and disabilities, what they're facing, what is psychological resilience, what makes people resilient, and then how can we build psychological resilience. So I'm laying out the context, but then, like I said, more questions, please. Next slide. So the anxieties that people with chronic illnesses and disabilities, of course, one of the big ones is, are we more at risk of being infected by the coronavirus? For those of who are more vulnerable, who may be having more immunocompressed body systems, they may be kind of fearing more a rise in their mortality fears in that sense. Some people older than 65 or with respiratory issues and ailments. The big one that's happening also is the absence of personal care attendants due to the quarantine. So that automatically the reliance tends to be falling back on family members to take care of somebody, let's say with a mobility or any other disability that requires assistance. Not being able to procure medications in time, a lot of people have faced, especially those with lupus who needed specific medications, those were in shortage. So there was a little bit of fear and anxieties around that. Absence of daily routines such as physical therapy. And then now looming large is the financial and job insecurities. Will we have a job? What is the new normal going to be like? And for a lot of us out there, or a lot of people out there with disabilities who are already feeling vulnerable, the vulnerabilities have honestly increased a little bit more manifold in that sense. Being unable to access healthcare services because of, again, there's still anyways, there was stigma associated, but now there's a lot more fear in terms of accessing healthcare. What I've tended to hear from people is that they were already feeling invisible before the lockdown happened, and now they're feeling further marginalized because of the lack of access to healthcare. So that itself is making them pretty anxious in that way. Next slide, please. So what is psychological resilience? It's actually the ability to mentally or emotionally cope with the crisis and come back to equilibrium and a sense of well-being quickly. So in other words, how can I bounce back faster after an adversity or a stressor? What it helps is it draws on your inner strength, and we'll talk about more, and it's not a personality trait, but it's honestly an attitude or a way of thinking that you can learn, and in a way it reflects in your behavior. And we'll talk about the dimensions, but garnering appropriate strategies, being proactive, and getting that support to accomplish your goals, to even if it means to reach out to others for support. So it's not that you have to be stoic or you have to feel like I can deal with this on my own. But again, when it needs reaching out for support, can we do that to make our ends meet? Resilient people are self-efficacious, and what I mean by that is that perception that we have the ability or the belief to deal with situations in an effective way. So to problem solve and to be effective in combating those issues and stressors that are facing. So that's what resilience means. Next slide, please. And this, of course, Aparna has talked about, but can it be from fear to growth? How do I change the way in which I'm perceiving this current situation, from looking at it from an anxiety triggered point to actually learning from it and to moving towards the area of growth? And if you look at all those statements that I mentioned there, you'll notice that it's actually a reflection of how people are thinking and approaching a situation, and that translates into how they behave and respond. So can we move from fear to growth, and how do we do that is what I'm going to talk about. Next slide, please. So I'm just going to briefly talk about the 6 domains of resilience. And in the end, I do have a small audio clip I want to hear from Vaidhi, who's actually a patient, who's a client or a person with a disability who's really demonstrated the 6 domains of resilience. So if you look at it, it's having a vision, so a purpose, having goals, finding the way to meet those goals is something that a resilient person does. Composure, and again, this is something which, if you're calm, if you're operating from a sense of not anxious and from being calm, you're actually able to problem solve through situations better. So then that's the next step. How resourceful are you? How can you anticipate what, without worrying and without being paranoid, how can you anticipate a situation and plan for it rather than just getting anxious or that anticipatory stress that we face? How can we plan better? Resilience need to focus on overall well-being. So health, of course, is one of the big ones, taking care of nutrition, sleep, physical activity. How persistent are they? How tenacious are they in dealing with the problem? And so how is their outlook towards bouncing back? And again, seeking that social support. How collaborative can they be, where they can again find means to that end that they're looking at. But like I said, we'll use a case example to demonstrate those 6 domains of resilience. Next slide, please. All right. The one thing I do want to talk about, and maybe in the end, so how can we build a psychological resilience? Like I said, being proactive, focusing on problem solving, amplifying your voices. So like I said, a lot of times people are facing that issue of we are not heard of, but how can we in this time mobilize our resources better so that we can express to people that we are here and we need to be heard and our needs need to be also met in that sense. Directly addressing problems, confronting your fears and arming them with facts. Like Aparna said, one of the biggest ones is the fear of the lockdown being extended and what it's doing. Again, I'm just saying things like, can we take it one day at a time, but can we also anticipate and make sure that we have planned well in advance to take care of our basic medical needs, our daily sustenance needs in that way. Coping with anticipatory stress effectively, again, how can we arm ourselves with facts rather than just being anxious? And if you notice that behind our feelings of anxiety is the way we are thinking about things. So can we reframe that better and cope with that anticipatory stress better? What do I have control over and what don't I have control over? So again, and the big one that I've been talking about is one of the fears that I've heard people talk about is the fear of the unknown. So while the media and all the social sites are talking about, are bombarding us with information, but there is a lack of clarity in a sense in what to expect and how to plan for. So that fear of the unknown is actually what is making people more anxious. So what can I do with all that information coming in? What is my relationship with the media? Can I reduce that? The only thing I can control is what I'm doing in the four walls of the house. So how do I manage that better? The physical distancing, the planning my day bit, all of that becomes important in that sense. Learning from experience, and what I do want people to focus on is think of how you've overcome hardships in the past. And that's one of the ways in which I want you to reflect on. You have used ways of thinking through situations, how you felt, what you did in those situations that you can learn from and say, I did overcome that. Think of the skills and the strategies that you used. On the flip side, remember the negative thoughts and perceptions and actions that actually prevented you from having a successful outcome and from growing from those hardships. So again, fall back on that experience and figure out what did I do right and where could I work on. Making your days goal oriented, meaningful, with a vision and purpose. In these times, what I'm basically saying is, if you can't go out for physiotherapy, are there basic exercises that you can do at home? Can you wake up at the same time, or maybe a plus minus half an hour here or so, but have activities that you're doing on a daily basis. Because again, when we are sitting without a structure to our day, or we're sitting idle, that's when our mind starts ruminating and all these worst case scenarios and catastrophizing, looking at doomsday scenarios tends to start happening. So can we engage in meaningful activities, again, which are more purposeful? Again, can't change the past, can't predict the future. So can we be hopeful and can we visualize positive outcomes again? And that, of course, doesn't mean that we don't have a plan or a strategy in place. But again, acknowledge and remember the things that used to make you hopeful, because again, these are anxiety-riddled times that we are working on. Next slide, please, Aparna. So what I talk about when I talk about being stress hardy, it's not that you're avoiding stress, but you're actually doing something to mitigate the effects of stress. So again, resilience in a way acts as a buffer to reduce the impact of anxiety or sadness that we feel when a stressor comes about. So the 3 C's that I talk about, again, if you look at it, it's how we are approaching a situation. So can we see it as a challenge instead of as a threat? Now that itself, if you notice, will spur you, will energize you in different ways. So instead of being overwhelmed and feeling helpless, can I use the situation to do something and use it as an opportunity for growth? It may not be easy. Again, we're not wishing away the problem, but we're dealing with it head on. How committed I am to actually overcome that situation. What do I have control over? And what do I let go of? So what can I control? Again, my actions, how I'm responding to this becomes important. Again, for a lot of people with disabilities out there, your conditions may worsen or exacerbate when you're in a state of stress. So I know that Patients Engage has done series on mindfulness and wellness initiatives. So again, please be cognizant that your stress levels need to be managed so that you are in good health. Again, cannot emphasize more supportive networks that you may not have used earlier, but now is the time. Let's say when people are in lockdown, don't have people to help with, let's say, procuring medicines or food. Can people help us from our neighborhood, from friends and family who can come out and support us, again, with maintaining adequate physical distancing? Can we mobilize our own resources, use technology wisely to reach out to people? And for those, and I'm just going to briefly touch upon this, is those family members or friends who are pitching in the absence of attendance. Please take care of your stress as well. Because again, like Aparna mentioned, there's lack of privacy, there's increased workload, you're doing your own work, you're managing the house, and then there's the added responsibility of being a caregiver. But can you also make sure that you're taking adequate rest, nurturing yourself, taking care of your overall sense of well-being as well? Next slide, please. And so what I used I requested him today to speak up about his experience in the past 5 days. And we'll just hear what Vaidi has to say to summarize the idea of resilience and the concept.
Friends, I'm S. Vaidyanathan, an alumnus of Indian Institute of Management, Bangalore. I sustained a spinal cord injury while I was a student there in 1990 and have been a wheelchair user for 30 years now. I work full-time for people with spinal cord injury in India now. I'm also India's first half marathon runner on a wheelchair, and I've done 16 wheelchair half marathons so far without assistance. On April 22nd, 2020 at 9:30 p.m., complete strength appeared to drain out of my body. Below the chest level, in any case, I can't feel anything, but I felt as if I had no hands. I became disoriented. I decided that I should be careful. I started paracetamols as there was mild fever. I took rest, and the next day I immediately checked with my fitness trainer for the past 10 years, as well as my doctor who takes care of my rehabilitation, and both suggested I should self-isolate. I self-isolated at home, and In the process, I ensured that there was only one person coming into my room, and he will bring the food. I'll push the wheelchair to the door. He will leave the food on it, push the wheelchair back towards the bed. This ensured that at least 6 feet distance was maintained between the person and me. I also ensured that I was touching nothing except uh, being on the bed, on my wheelchair, and one switch point for my mobile. Other than that, I consciously avoided touching doors, other furniture. I avoided going out of the room. The bathroom door alone, I used to push with my wheelchair and open it and then close it back in a similar way. Uh, the only thing I used inside the wash room was the wash basin. After I finished, I used to fill a cup with water, then pour Savlon on the tap, and then use the water and pour the water on the tap to ensure that the tap is hygienic for anybody to use. So it went this way, but I developed breathlessness on April 24th afternoon. It became intense the next day, and I realized if it gets to breathing difficulty, I would have no choice of where I wanted to go, and I was clear that I have to be proactive. I've always been proactive, collaborative in my life, and that helped. I quickly consulted with my medical friends, and I decided that I had to go to Christian Medical College, Vellore, which is where I had my rehabilitation after my spinal cord injury, and so they know my complete history. That proactive move helped me to come here uh, yesterday afternoon at 1:30 p.m. And today, as I speak to you, uh, about after 18 hours, I've been seen I've been seeing significant improvement. I had a COVID test in the morning. The result was due if result is due at 6 p.m. today, and it could be COVID, it could be a bacterial respiratory infection, but whatever it is, I think it's very important to stay calm, speak or speak by messaging or audio messaging uh, a few people whom you trust, and uh, take a decision decisively. For example, one additional thing I did on April 25th night was, because I was so breathless and I stay alone, I decided I will not sleep the whole night just in case I pass out, because nobody will come till my caregiver comes at 6 in the morning. So I just played MS Subalakshmi music, stayed awake the whole night, and next day the journey to uh, the hospital started. So stay calm. I request all of you to maintain social distancing in the time of COVID. Social distancing is staying at home and maintaining a physical distance of 6 feet when you're outside between you and any other person. Nothing else helps. Thank you.
So I'll just summarize that and say that with these examples, the staying calm, being proactive, and then having and stemming from that and doing the problem solving and reaching the hospital, one of the best things, one of the best examples that I could come up with today. His COVID test did come negative, so but he says he'll have to be careful because it is a bacterial infection, so he has to still be careful for the next few months. So now, of course, over to your Parna and questions.
Sure, sure. Yeah, it's always great to listen to Vaidi. He always has great inputs for people. Um, so I'm glad that we could get an audio from him. Let me start with some of the questions we've already received. I think, as you mentioned as well, one of the big challenges is, the therapy sessions have got affected for a lot of people. It could be physical therapy, it could be other forms of therapy as well. This has two effects, right? It, on the one hand, it does start to affect the health of the person, and there are symptoms get aggravated. On the other hand, while everybody says you should keep doing it at home, the motivation to do it at home on their own. So if they were part of a group, then the challenge of motivation comes in, or if they had somebody coming in, then there was a routine to somebody coming in, whereas that it's very difficult to get to for a member to sometimes convince the person to do the exercises on their own or with the family members. So what's your advice or recommendation in those scenarios?
Sure. So what I've been telling people is, of course, it's so easy to give all this these instructions, right? Work out from home, eat
Correct.
well, sleep well, but then we often fall off the wagon, and that's because somewhere that intention and that motivation tends to start faltering. So that's the reason I'm having people take that proactive stance and say, okay, we're in this for however long, we don't know yet, but what is it that I want to do on a daily basis to maintain my health or to work on it towards improving it? I'd rather say, can we maintain status quo than actually have see any decline? So that said, again, when I say what can I control versus what I cannot, people cannot come into the house because of the quarantine, and that's not feasible. So what is it that will build my motivation to do my exercise? How many times in a week do I want to do it? What's the modality I'm going to use? What are the obstacles that I can identify that are coming in the way of me actually doing it? Most of them will be internal, that I don't find the motivation. What will happen is we get stuck in conflicting thoughts. I want to do it too, but I still don't want to do it. And I'll say that will always create that restlessness. So I'm saying choose one. Either say I
Right.
don't want to do it, and then just decide that till the lockdown doesn't get done, I'm going to take it easy. But then of course it doesn't mean, but then what will happen if I lose my health status? It can't be two conflicting thoughts. So what do I choose? It doesn't need to be perfect. Can I learn some exercises at home that I can do which may be more interesting, which will sustain my interest? Can I get my physiotherapist on a Zoom meeting or a Skype where he or she can motivate me to do that, because I may just respond more to my therapist than my family member? But if it
Mm.
involves active stretching, manipulation, can my family member or somebody else assist? Or what is it that I can do on my own? So having a game plan does become important rather than having an unstructured approach to your day and just wallowing in, should I do it, should I not do it, I don't like this, I don't like this. Can we develop a way in which can it be workable and sustainable? It doesn't need to be perfect, but is there 10-15 minutes of therapy that I can do which will at least maintain my health status? Or can it
Right.
just be remaining active at home? So what is it that I'll enjoy? What obstacles can I work through? And what are some, so when I say problem solving, coping, that's what resilient people do. I'll come up with plan A. Plan A doesn't work. Okay, let's do plan B. That doesn't work. Then let's come to what can we do? So it needs to be action oriented in that sense.
Okay. Thanks, Divya. Just for people out there, please, send in your questions as and when you have them. Um, I think one of the things that we're also hearing is that sometimes people are finding it, not sometimes, often people are finding it difficult time to focus, even those who used to do, like multiple activities. They are feeling drowsy, they feel dull, there's a
Mhm.
bit of brain fog. Is this related to, is this more mental? Is this more physical? What would your advice be to them?
Okay, so and that's the other thing, right? That we are anyways people who everybody across the spectrum, for most of us, are anyways stressed out because of the lockdown and what COVID-19 has done to us. So people who are able-bodied, temporarily able-bodied, are themselves struggling. On top of that, we have that anxiety plus people with disabilities and that stress and vulnerability. What I would often tell people is you are your best assessors of your own body and what it's telling you. So have you felt this kind of brain fog earlier? And for maybe for people, again, who've had cognitive impairments or mental illnesses or multiple sclerosis, when that brain fog sets in, um, are we looking at stress adding another layer? So have you noticed that before? Are you stressed out? And again, if you are, and stress takes multiple ways, the biggest ways it hits us is it affects our concentration, our ability to focus. We feel restless, we feel nervous, there's a buzz in the head. Of course, then the somatic issues also come. So ask yourself that, okay, what is, am I stressed? How am I doing on this sense of well-being? What is it that is stressing me out, and what can I do about it? So yes, I will say, have them in a way tune into their mind and body and say what's going on. But I will say, for people with disabilities and mental illnesses in general, we are noticing the added layer of stress, worrying, and anxieties, in a way impacting their health status a lot more compared to earlier times. And so again, one way is, for instance, mindfulness. Whatever it is that calms them down, whatever activity, whether it's diaphragmatic breathing, meditation, any physical activity, listening to music, like Vaidhi said, he listened to MS Lakshmi all night, and that calmed him down, even though he was trying to stay awake to manage that crisis. If you feel better after that, if your fog lifts, if you're feeling better, then of course we are looking at stress somehow being the main reason for why that's increased. Are you taking your medicines on time? How is your sleep? Is your structure disrupted because of the lockdown? A lot of people are talking about insomnia being another issue that they're facing with this.
Correct.
Is their sleep cycles affected? So just look at how your day is panning out, what's stressing out, what's not. Tune into your mind and body, and you'll find the answer right there.
Okay. Here's a slightly longish question. It's a good question. Hi, this is Dilanti, child psychologist from Colombo. Thank you for the opportunity to discuss issues for PWD through this helpful. Though robust, your model assumes a high degree of agency and strong social skill amongst the community you work with. Do you have any thoughts about how we could support less confident people with disabilities or families slash members of a community?
Perfect. I absolutely, and I mean, of course, in India, most of our people with disabilities are in those sectors itself, right? Where they may not have those opportunities, the technology, the social support, etc. But honestly, I feel, if not now, then when will we address building up those agencies, and can we collectively as a and I think, again, even now with this lockdown, we haven't really paid heed to what people with disabilities are going through. How many of our instructions are in braille, or do we have masks which people with hearing impairments can look through and find and lip read? We haven't catered to their needs. So, but still, can we mobilize those resources right now collectively to help them raise their voices? But if not, build that sense of agency. I don't think under the lockdown we can really do anything to build that sense of agency, but can we in the future work towards building their sense of agency up? But for now, can the community intervene? Can we mobilize neighbors or somebody else, or agent or NGOs, to start pitching in and supporting them? But I think you're absolutely right. What I agree with Delanti, that for a lot of people who are in the more remote parts of the country, we haven't even gone to how they are even dealing with this. But I agree. I mean, what else can we do? But can that education keep coming about? But can we as a society kind of support them at this point? So it's more on us, the more resourceful ones, who can pitch in and collaborate with them rather than waiting for them to reach out to us.
Yeah. So I think that kind of brings to the other point, right? Caregivers often struggle with this as to, uh, I mean, they may ask the person with the condition or the disability to, to exercise, to do stuff, that to listen to music, etc., etc. But how do they kind of get across that barrier that might be building up because of the stress and the anxiety, that kind of motivates them to take those actions, right? Because at the end of the day, the action still needs to be taken by the person concerned.
Mhm.
So
So,
how is, and how do we navigate that without, again, it also links back to, because after a while that relationship can become quite uh, uh, you know tense if you keep
yeah, yeah.
reminding the person to exercise, or keep
Mm-hmm.
reminding the person to do things that make them positive or whatever, right? So
Mm-hmm.
how does a
Mm-hmm.
caregiver navigate that?
Sure. And I'm specifically just talking about the lockdown period for now. And I've been telling everybody across the board that somehow we got this notion that, oh, we have this lockdown and this is like the golden opportunity. We can really be productive, learn that skill, do that hobby, pick that, focus on our health. We honestly don't realize that there is a lot of stress that is on us to maintain work, to maintain the house, to take care, and to, again, I think we often fail to address our own vulnerabilities and anxieties as well as caregivers that we may be experiencing. So in this time, I'm honestly going to say we've got to pick our battles. But I'm saying, let me get to the first step, which is to be patient and empathetic. And one, reach out to our loved one with a disability and try and understand what their stressors may be. So again, for them, their frailties, their fears, and this may be very real for them, may not be for us, but empathizing and saying, that's where they're coming from. Let me see what I can do, or ask them, how can I be of assistance, or how can I help them to calm down? So can we, because again, their motivation will be affected if they are anxious and stressed out. They won't feel like doing anything proactive at that point in time. So can we just be there, understand, intervene at some level to say we understand. How would you like us to support you? What would you like to do in a day?
Mm,
Of course, I'm saying certain things will have to be urgent, right? You can't compromise their health. If they say, I don't want to have medicine, now that's a no-no. But okay, what is the tipping point? Like, what is non-negotiable versus I can let this be that, okay, if they're not exercising every day, is it make or break? But medicine is essential. So can we agree on some things that we need to do? It needs to be collaborative. If it's like talking to them and instructing, it's not going to work. So what's the approach that's going to help mobilize their resources? Can they take the ownership and responsibility? But why are we having to nudge them to do that exercise? Is it because we want them to, or is it really like, or to keep them busy? But what is it that they want to do? Maybe right now we need to focus on exercises or activities that may help calm them down. So can we as a family say, you know what, let's do that meditation that somebody had taught us, or can we communicate? Let's say they say, but I'm worried about XYZ, that, I may be fearing this in the future. Can that be dealt with? Again, if some of it may just be very intense anxiety, which a family member may not be able to take care of. In that sense, I will say having that professional consult, reaching out to the community, to counselors, is of course a good idea. But again, picking your battles and saying what for me is an important one that I would want them to engage in. Can it be collaborative? Can they draw up their own plan of what they want to do in a day, rather than it just being me telling them what they need to be doing? Because
right.
again, it's like, how much can we also, that's the other thing, right? If I'm constantly telling them and they're not listening, what is the, it's like breaking your head against a wall, and like you're saying, it's going to lead to that conflict and that strain in the relationship. So can we give them that space, and then have them gradually start building up those activities that they want to engage in, to kind of have that meaningful structure to the day that we're asking them to have.
Right, right. We have a very specific questions. I'll put it out, but I think in case you can't answer, we will put,
Mhm.
we'll respond to it on the Facebook post as well. Can people with scleroderma or RA contact any resource person for care and counseling support? you aware of, I mean, I know a couple of support groups that are working in this space, but if you have
Hmm.
anything specific, please.
I wouldn't know, but again, I would often say that depends again on the issue. If it's related specifically to the scleroderma or RA, and that's having an impact on, let's say, their mental health or their sense of self or their body image. If that's specific, of course, we need people who know about those conditions. But if it's general, like, I'm just stressed or anxious or depressed after the lockdown, that any can any mental health professional answer that? So I would say if it's specific to that condition, I would again say reaching out to NGOs or support groups that are specific to RA and scleroderma should be reached out to. But yeah, I wouldn't be aware of that personally at this point.
Right. So yeah, I know. I think scleroderma. There is, if you're from India, there's a scleroderma India that is managed by Neetu and a couple of other people. So I think you know that. RA, we can uh, get back to you on specific, but I don't know Kirtida if she would have some suggestions. I know uh, there is the Sjogren's group as well that supports this. Um Right, and I think we are getting a lot of comments on Facebook. Just waiting to see if there are any questions there as well. Um, I think the other thing that what is a strategy that people can follow to uh, kind of recognize that people are going to live with this COVID-19 coronavirus for a long time. So while we will not be in this lockdown stage for, in this current stage of restrictions, but there will be some social distancing norms that will probably continue for extended periods of time. Um, so, how does somebody kind of start planning for that stage and, start thinking about that?
Hmm. Like I said, I think the fear of the unknown is what is bothering the most of us at this point. But focusing on what facts do we have, like you're saying, with physical distancing, that's what we know is going to be something that we will be formulating or practicing for a while. So if you're somebody who has to use public transport, start thinking now, okay, what is an alternative? What will be my plan A when I have to make sure I'm maintaining physical distancing? How will I manage that? How would my commute be? I know a lot of us are already, kind of thinking about the financial, the job insecurities that may be looming up. We haven't even started talking about that yet. But okay, you know, if work from home is an option, can that be sustained? Financially, do I need to start planning a little better? Looking at, I've already been saying, can financial advising is something that we can start taking? Where can I make sure that I'm not cutting corners, but where can I save wisely? What can I do? Again, I will always say, any stress that comes, when I keep saying when that fear comes or whenever any worry comes, arm it with facts and what can you either do about it, or how can you change the way you're thinking, or any other self-management strategy in that sense. So if it's reframing a situation, a lot of times, like I said, we catastrophizing, what if this happens, or the doomsday, just roll back in and say, we'll see, we'll take it one step at a time, and then maybe more information starts rolling in, kind of just holding our horses there. A lot of us are waiting for specific directives. So what can you control? Can, knowing the facts that are coming about, how can I start problem solving and planning better rather than feeling overwhelmed, helpless, anxious, saying, oh, so much is going to change. What's the new normal going to be like? Can we just take it one step at a time? Start prioritizing what's most important to you, and whether it's work or whether it's getting out of the house, how will you commute, what is it that needs intervention? Start planning that already. But I think the biggest one I'm kind of telling people is just brace yourself for the change. A lot of us will are already, there is that other faction which is like, oh, everything's going to be okay. And I'm like, that's kind of, in a way, I hope everything's going to be okay, but you have to be realistic. You
Right.
can't deny that there will be problems that we will face. So just embracing it and saying, you know what, these are going to be tough times. And that's where the self-efficacy bit that I talk about, that I have the ability in me to work it through, to manage it. It may be difficult, but I will find some way, or I'll accept it for now and kind of just keep persisting in dealing with that. So rather than just getting overwhelmed. So like Vedi said, be calm, be proactive. What can I do? How can I approach this becomes essential in that way.
Right. So I've got a question here. I have OCD, panic and anxiety disorders. I'm on the autism spectrum, and a lot of these are comorbid conditions. I have emotional resilience in my aloneness, but when interacting with people, I lose my emotional resilience. What can be done about it?
Um, okay. I would I mean, I think one of the things, and again, I would want to kind of also ask as a backup question, follow-up question, is that are you facing that loss in emotional resilience in interacting with people now, when maybe your anxiety may be a little more high in the lockdown period, if at all it is? Otherwise, I think if you feel like it's been a consistent a problem or an issue, and if you want to work on that, then I would honestly say that taking that professional advice, because again, when you lose your emotional resilience, I would want to know what exactly about that situation is making you, whether it's making you more fearful or it's making you more anxious. It's again that filter with which we are seeing that situation, right? So for anybody to kind of intervene, it'll be at that level, saying how can we make it more amenable for you to interact with people better, if that's what you want to do, again with that comorbidity of autism that also may be acting as a layer. So that's something I would say, with
So
professional
just on that,
intervention
he
is
has
something.
clarified that
Yeah,
it is
yeah,
general, not specific
yeah.
to, yeah.
Yeah, yeah. So then I'm saying, in addition to any other, the OT or any other occupational therapy that you're going through, please address this component with a mental health professional, because again, they will have to understand what is it about meeting people that is making you fearful. And that's again something which is going to be specific to you as an individual, and how does one work with that. So I wish I had specific suggestions, but I would say that's something which qualified professionals should work with you on. I mean, I'd be happy to answer that on the side if that's what
Right.
you would
Thanks. Thanks.
think.
So I think, I guess one comment and then a question. So somebody says the lockdown's like a virtual experience for non-disabled persons and what it feels like to be so socially isolated. It should create more empathy. We have faced practical problems because carers are not able to come to our house, and my loved one needs 24-hour care. So that's kind of a
Absolutely.
challenge. I don't know if you have any suggestions. There's another question. Do you want to address
Yeah.
that quickly?
I mean, and I totally agree. That's what I'm saying. This is something which hasn't been addressed, and I think the lockdown has been so severe that special needs considerations haven't been addressed well. Like it's a blanket order. So I totally understand what families are going through. But like I said, at the same time, when it's fallen on a family member, again, I would say prioritize things. Where can your care for that person, for your loved one, be done, but can some things which are not very urgent, let's say about the house or work, can that be put on the back burner? But can you also take good care of yourself, like keep pausing, keep coming up, keep taking care of yourself as well. But I agree that I think we've totally missed out on taking care of the needs of people with disabilities at this point, because and so just if you have a personal care attendant, and you're comfortable, and he or she is comfortable with staying at home under the lockdown with you, is that an option where you have some help at home rather than somebody who's coming in and going out? So just kind of figure out what workable solutions. Can you have other family members pitch in? Can it be a more collaborative effort rather than it just falling on one person?
Right.
So can everybody share responsibilities? So in that sense, just take care of yourself and your loved one as well.
Right. And I think, as somebody said, one of the other challenges is that the primary carer may not be, uh, fully capable or aware of how to handle, things
Mhm.
like therapies or even physical therapies or
Mhm.
stretching and stuff like that, right? So
Mhm. Mhm. Yeah.
they probably have to go and figure out ways to learn how to do it and then do it,
Mhm. Mhm.
or it might, in some cases, may be safer not to try to do it as well.
Exactly. So I think the best thing to do in those cases are honestly consult with your physical and occupational therapist, saying what is the basic that we could do without the intervention of the physical presence of the therapist. Like you're saying, I think a lot of people just, again, what is the reason why we are doing that therapy? If it's just to maintain range of motion, can it just be with everyday activities that we can maintain it? But if it's anything more than that, then how does one manage that? But in that sense, I think I would rather, and that's for a physiotherapist to honestly intervene and say, I would rather kind of maintain basic care than do active physiotherapy, which is again something which may put your family member at risk. So, in that sense, so I would say just consult with your PTOT to get a routine saying what is it that we can do at home without the physiotherapist actually being physically present.
Right, right. And I think, again, as Divya said earlier, that most of the people who were doing stuff have, tried to, or at least there are some who are trying to set up online activities around this. So always get in touch with your therapist or your OT to figure out what's happening,
Mhm.
or if you don't have that, let us know. We do know of various groups that are trying to do these, so we can always suggest those online sessions for you. So I think that's definitely what we can do. Let me quickly share back the kind of last slides. So I think we don't have any more questions, but I think it was an extremely useful session. Um, and, as we keep reminding people, it's always important to move, stretch, exercise at home. Just movement helps a lot. And, get regular, snatches of sunlight, even if it's looking out of a window. Ask for help if you're not sure. Reach out to somebody. A lot of online counseling, online helplines are available now. So reach out to them, discuss them, reach out to your regular professional support mechanism that you have. If you have a regular physiotherapist, you have a regular OT, you have a support or counselor, talk to those people as well. And just for quick reminder, on Thursday, 11 a.m., we are talking to Dr. Anve Mule and heart transplant patient Rishi on handling heart failure and heart transplant during these days. And thank you, Divya. I think it's been a really useful session, and I think it's helped a lot of people. I think we're already seeing a lot of comments on Facebook about it being a positive session. So thank you for taking the
Thank you
time.
so much. Thank you, Aparna, and thank you all who have taken out time to attend this. So thank you so much.
Yeah, thank you to all the
Okay,
panelists, attendees, and the questions.
thanks. Thank you.
Thanks.